Time for another Orthopedic Minute, presented by Washington University Physicians.
Hi, I'm Dr. Robert Brophy with the Department of Orthopedics at Washington University in St. Louis. When I see patients in the Orthopedic Center in Chesterfield, they often come in with problems related to the meniscus in their knee. In some cases, their meniscus ends up needing surgery. Most of the time, that will involve a partial menisectomy, where we clean up part of the knee, while in some cases we can actually repair the meniscus. This is an example of a meniscus tear that needs to be cleaned up or debrided with a partial menisectomy. We use a biter to start to break up the tear into pieces that we can take out of the knee. You can see we go back to where there's good, stable remaining meniscus. We also use a shaver to clean up the debris and smooth out the edge of the remaining meniscus. At the end, we test the meniscus with our probe to make sure all of the meniscus that remains is stable. A meniscus tear with a clean tear pattern like this can be repaired. We often use a device to place the suture in the meniscus. After we've placed the first suture, then we can use our inserter to place a second suture into the capsule, which is done here. Once you've placed the sutures, you can tighten the knot and then cut the excess suture coming out of the joint. At the end, we use our probe to test the repair and make sure it's tightly secured. I hope you found these examples educational and informative. Remember, if you have knee pain, you need to be evaluated by an orthopedic surgeon, and you may not always need surgery even with a meniscus tear.
For more information, visit ortho.woostel.edu.